A warm welcome from me. I see many people here, I know. So it was very nice that you mentioned what SMI means, because I always called it SMI. I never looked it up, and I did it 15 minutes ago to make sure that I know what I'm talking about. But Superb Microvascular Imaging, a new technique linked to Doppler. So first trimester ultrasound is for us here as specialists more a routine, the first anomaly scan, and it's not speculation, and it's not something for the future. Is there, and we know that we have a very high detection rate in the first anomaly scan, so it's part of our daily routine. And of course, everybody is talking about or have talked about first trimester screening, and so the question for the audience is, what is longer there, first trimester screening or first trimester anomaly scan? And you can guess when I ask you that the answer is, of course, the ultrasound was there first. So first papers published about first trimester fetal echocardiography were published in the 90s, almost 30 years ago. Major work from Uli Gembruch and also from Israel. A lot of work done 30 years ago, well before first trimester screening hit the market. So it's standard for us. So when I do first trimester ultrasound, what I do need for in that time? Of course, I need superb grayscale ultrasound. I think everybody's sitting here knowing that the Canon system are very capable of that, so we want to talk about that anymore. That's done. Then you need color Doppler or advanced dynamic flow to increase that. You need your spectral Doppler, and I will show you through some pictures how SMI can improve the quality of your first trimester ultrasound. And I'm working in a private practice, so what you will miss in this talk are pictures like that. This is fake news. Why is this fake news? This is a fancy breast ultrasound scanner with absurd high frequencies I use for brilliant 4-chamber views in the first trimester. But in my cohort of patients, I cannot use that regularly. So what I'm presenting you is are pictures from the real world, and even from the patients, which are technically difficult to show. So what we are using for SMI nowadays will change our perspectives of first trimester screening. Just to show you some, this is an easy thing to do, to look for a circulus villisi. Basically, in the first trimester, our cerebral exam is very basic, to be honest. Of course, because the anatomy hasn't developed so far, but also because our insights with ultrasound are limited. I think with SMI we will enhance our idea about first trimester scan, especially in the part of the brain. And you can see that also in an anterior posterior view. You see the cerebral arteries, even posterior arteries, and anterior arteries, and you have seen the middle cerebral artery in the last video clip. So even you can try to display the coronary view with a pericallosal arteries. Of course, there is no corpus callosum, so at that time, so it will develop, but you can already see the vascular ring there. So this is very easy. So in your daily routine, what's important? First trimester routine, localization of kidneys. Unilateral agenesis of a kidney is not so rare. So you can display that in grayscale, and if you have a better width resolution, you cannot see them. You can take color Doppler or advanced dynamic flow Doppler to visualize the renal arteries. And if you have problems with that, you use SMI just to clarify the situations. But in the case you're using SMI, you see much more. You have to relearn, rethink your anatomy, especially in the first trimester, because there are, of course, much more to see, like mesenteric arteries and stuff like that. Even in the placenta, it's easy to depict the umbilical cord. I think that's a very important thing we shouldn't miss, and we can judge about vascularization of the placenta, and we can do that in the first trimester, in the second trimester, and I think it helps us in evaluation of adherent placenta or placenta accreta. And of course, the fetal heart, I cannot, when I'm going through the fetus in the first trimester, I have to talk about the fetal heart. So the fetal heart is very good accessible in the first trimester. And of course, you use your high definition advanced dynamic flow Doppler for delineation of the septum. And you can even depict the umbilical, the venous return to the left atrium. But when you do so, of course, with the normal color Doppler, you have to fiddle with your settings. Everybody knows that you have to decrease your PRF, you have to increase the gain, and then you produce pictures like that. So my workflow nowadays is just with the basic setting of the color Doppler, I just switch to SMI and I can see the pulmonary veins very clearly in many, many, many cases, as you see these both here coming into the left atrium. So this is very easy and enhances my blood flow. This is a typical view, 3-vessel view. You know that our most important thing to show. And this is a very bad angle, of course, for color Doppler to visualize a possible aberrant right subclavian arteries when you want to display the arteries deriving from the aorta. When you use SMI, it's much easier. You don't have to reduce the PRF and fiddle like that. Like here, you see that. You just can switch on PRF. You can switch on SMI, and then you see the vessels branching off the aorta, depicting that there is no aberrant right subclavian artery. So with the fetal heart, it's very easy to see a lot of details, and there SMI really strives. You see that again here with a normal advanced dynamic flow, the blood flow compared to SMI blood flow. You see the venous return in the left atrium, and then here the vessels from the aorta in a perfect way in a really high resolution. So this is 12 plus weeks, so that works very well. And even the aortic arch with the branching of the 3 vessels, it's very easy to do that in a lot of patients in that quality. That works very, very well. So some cardiac defects, you see that. This should be an atrioventricular septal defect. And of course, you use color Doppler to see that you have this typical V-shaped influence in the ventricles. But when you see that in the 3-vessel view, this helps you in diagnosing the aberrant right subclavian artery very easily. You don't have to fiddle around with your settings. It's right there. You hit the button and you see the this aberrant right subclavian artery. So this makes things easier, I think, and faster, because you don't have to turn the knobs so heavily. So when you look on cardiac defects, like here in a very abnormal heart, you see the left ventricle is very small and the right is more normal. So this should be a hypoplastic left heart complex. You use the advanced dynamic flow for your routine, and you see just one big vessel deriving from the heart, and it's difficult to say where it's coming from. And the SMI flow helps you to figure out that this is a fancy hypoplastic left heart with a abnormal aorta pulmonary artery coincidence. So finally, I have shown you pictures, of course, from ladies where you assume that they're slim and low BMI, but in my cohort, I have some patients which are different, as you know them all, BMI of 48, and you see the grayscale. That's what you're expecting. We can twist physics from transabdominal. So what happens with color Doppler and SMI, you see the color Doppler there and with that lady. That works very well. I would say. You can distinguish 4-chamber view. And I think that's workflow for routine. That makes you happy when you can get rid of this patient by good diagnostic. And even SMI works, and you can see the inflow, and also when you're used to SMI, you even can depict the venous return to the left atrium. Another thing is, so of course, because of first trimester, we are just starting at 11 plus 0, and everybody knows I normally bite in my desk when my people scheduling me patients 11 plus 1 or something. Normally, it's, they're on vacation for 3 weeks and they just can come at 11 plus 1, but, I hate that, as everybody who's doing ultrasound. So this is different. So this is 10 plus 4 weeks. And even there, the SMI can give you a 4-chamber view. And when you have patients from remote areas, they have to travel a lot, and you don't want to send them home for coming back in 2 weeks. This will help you to get the job done, even in very early gestation. Still there, it's a scan through the fetus, cerebral, then the heart, and even here you see the umbilical arteries, and that's what I want to show you. You see the 2 umbilical arteries, and you can differentiate very nicely from the femoral arteries. So that's one of the problems. Missing single umbilical artery is sometimes you're misinterpreting a femoral artery as a left or right umbilical artery, and this is almost not possible with SMI. You have a very clear image here, and even you see the caliber difference between the umbilical artery and the femoral artery here. You can see that on both sides. This is very easy. So this was a quick stroll through SMI, and so finally what I would say there is, what I do nowadays is I do my normal homework with color Doppler or advanced dynamic flow, and when I want to display small vessels like the subclavian artery or the venous return to the left atrium, then I just switch on my SMI button. I don't fiddle around with PRF and gain anymore. I just hit the button and I get the job done most of the time. And it's then, for me, it's faster, better, and I can especially display the structures with low blood flows, and that's the reason it works perfectly in the first trimester. And finally, it even works with high BMIs for special patients. Thank you. And to prove that that it's not just fancy pictures, of course, we have a live scan over there, and might be some questions. So this is a late first trimester ultrasound. I don't have to talk about the resolution of the grayscale. It's obvious and works very well. And so this is the lie normally you don't like very much. You have no chance for a profile because it's looking towards the placenta. So we hope it will turn a little bit. So I do everything else. So you have this fetal head there. You go down to the base, and you see the circulus villisi. It's very easy. You see that it's complete. SMI is almost angle independent. You can see the middle cerebral arteries. The anterior arteries, you can assume that they're there, and the connection, so you have the complete vascular ring there. I think that's amazing, and maybe there may be some ideas of research in the future. I think that displays very good the capability of SMI in low flow. See, even in a very bad angle, almost transverse to the transducer. You see the posterior simple arteries there, so that works very well. Then, of course, I jump to the kidneys because that's a favorable lie for that. You see two kidneys, even in grayscale, but when you wanna assure that you have it, that's very easy to do. You see with SMI, you see both renal arteries there, bifurcation, aorta. That's very easy and very fast. So I'm done with that. I don't have to use color Doppler for that. I even jump color Doppler for these things. And if the fetus would be in a different position, I know, then we do. So this is turned a little bit. Fighting. So then we use it for the fetal heart. So even grayscale, nice for chamber view. Even you see the aorta there coming from the left atrium. You see the aortic valve, the crossing of the artery, the pulmonary artery, the three-vessel view in grayscale. You see the aortic arch in grayscale, but when you do use colored advanced dynamic flow with fancy luminance imaging if you want to. You don't have to. You can use the regular version if you like to. So you see the quality of the delineation at the septum, the ventricular septum, that works very well. And the three-vessel view, and now you see you get problems with the angle sometimes. So when you use the SMI there, you see the three-vessel view, and it helps you in displaying the pulmonary veins, to display them. And in the outflow tract, you see the three-vessel view, and there the vessels deriving from the aorta on both sides. There is no ARSA. You see, this is left, this is right. So from the aorta to the left side and to the right side, the vessels deriving from the aorta very easily. You don't have. I haven't touched a lot at the screen. I didn't turn any knob or so. I just used SMI as a supplement to color Doppler. Of course, you have normal color Doppler three-vessel view. And we have to go back because it's moving again. So I try to give you the aortic arch. Neue Patientin, oder? Okay. So, and you see that on this apical four-chamber view. This is always a challenge for color Doppler because of the resolution, the temporal resolution. And when I'm switching to SMI, you see suddenly you have this pulmonary vein coming up to the left atrium here, and the other one there. So we do really with SMI, we do quality second trimester fetal echo in the first trimester. And the angle is not good enough for the aortic arch in that way, but you see the resolution will give you the chance to bring it all. So.
Is there anything you'd like to see or like Martin Krapp to show?
So, and even so, when you'd want to display the ductus venosus, of course, you can do so with a normal advanced dynamic flow, and you get a very nice overview using SMI for that. And just by the way, without purpose, you see the aortic arch with the 3 vessels deriving with the ductus venosus there. You see the tiny ductus venosus entering in the inferior vena cava. So this is not possible with any normal color Doppler, advanced dynamic flow or whatever. It's this extremely high resolution. So you can, I think this is very important even when you want to rule out early abnormalities in terms of vessel misplacement, like missing inferior vena cava or something like that. That seems to be very easy with this technique, even in the first trimester. Okay.